Okay, good night, and this is yours truly, Dolphy Gilpin, coming to you from Decatur, Georgia, with a brief description of erythrocytosis. And let's turn on our OMAX microscope, which is in the background. And we know say erythrocytosis is an increase in the production of red blood cells or erythrocytes. And that primary erythrocytosis results as a result of Polycythemia Vera, which is a myeloproliferative disorder or disease, which is caused when the bone marrow produces excessive number of red blood cells or white blood cells and platelets. Now, secondary erythrocytosis is erythrocytosis whereby only the red blood cells are produced in excess. And in secondary erythrocytosis, what we have is tissue hypoxia. So that's a brief difference of primary erythrocytosis and secondary erythrocytosis. In secondary erythrocytosis, only the RBC or the red blood cells are increased, whereas in primary erythrocytosis, which results as a Polycythemia Vera, which is a myeloproliferative disorder in which the bone marrow produces excessive number of red blood cells, white blood cells, and platelets. So we'll be looking at not only erythrocytosis, but also thrombocytosis or thrombocythemia, leukocytosis, which is an increase in the white blood cell production of white blood cells, and pancytopenia, which is a decrease in the amount of red blood cells, white blood cells, and platelets. Pancytopenia seems to be the opposite of polycythemia, in which that is primary polycythemia, in which there's an increase in the red blood cells, white blood cells, and platelets. Whereas pancytopenia is a decrease in red blood cell, white blood cell, and platelets. And bicytopenia is a decrease in any two components, whether the red blood cell, white blood cell, or a combination of the red blood cell, platelets, or a combination of the white blood cell and platelets. So that's a look at the erythrocytosis, primary and secondary.